I think a good doctor has to be dedicated. He has to be empathetic with the patient. You have to hear them, and you got to make sure that you understand them and put yourself in their shoes in order to take adequate care of them. From an early age, I was very involved in science. I think the problem-solving nature of science and the constant innovation definitely led me to it. And I think medicine just was the field that I was able to combine all those interests. And I was very involved in sports as well. So definitely that combination between science and sports led me to orthopedic surgery. And that's how I got basically into surgery itself. With orthopedic surgery in particular, you get that instant gratifying feeling of fixing something and getting that patient back to where they were before that. Hand surgery is a very broad field. You cover from fractures to tendons to nerves, compression of nerves like carpal tunnel, cubital tunnel. Those are the things that we see the most. And in the older population, the more degenerative conditions as osteoarthritis, right? In our younger population, it's more the sports injuries, the fractures, the tendon lacerations, and nerve injuries. Initially, when you see a patient, the main thing is trying to figure out what limitations they have due to their condition and how we can treat them. Initially, you start with a very conservative, non-operative management, right? Initially, physical therapy, pain medications, definitely injections help. But when those things, the non-operative management fails, then there's always surgery. With hand surgery, there's a lot of minimally invasive surgery. We used to do carpal tunnels through a bigger incision. Now we can do those surgeries through a 1 centimeter incision. So there's a lot of new technology coming in the hand surgery field as well that we're adopting here a bit more in order to take care of our patients. For me, it's important getting to know the patient, getting to know what they like to do, right? What's their limitations? How is this condition limiting their daily activities? How are they being affected, their sports, their hobbies, right? Sometimes when you have a hand injury, they can't play pickleball, or sometimes they can't eat with that hand. So those are the things that you got to be aware. You discuss the treatment options with the patient, and then we try to get them back to where they were before. We as physicians are privileged, right? And every day we have the opportunity to impact patients, right, on a daily basis. Sometimes in the clinic, sometimes in the operating room, basically fixing a fracture, fixing a tendon or a nerve. But definitely you can see that how that patient goes from being unable to use their hand, being unable to do their daily stuff, to with physical therapy or with medications or sometimes with surgery, you can get them back to where they were before and being able to do the things that they enjoy.